Muted.
It is true. I am the MAP project coordinator, but actually I think my real love is just doing counseling during the Part D time. So I really enjoy helping. So I hope I help you today. And with that said, I have a lot of information to give you today. And when I'm done with this, I'm going to give it to Macomb County, to Bev and to Lily, and they can tweak it and do more presentations with it. And also I'll put this one on Ship Tools as well. So as we go through all this information, bear with me. I know there's a lot of information that you may possibly not want to know, but I think for the most part you'll find it all helpful. So I'm going to start with slide 1 and just refresh people's memories that an integrated care program is designed to cover both your physical and your behavioral health. It's supposed to give you cover the whole body. And so that's what my Health Link is designed to do, to provide all the services you need for behavioral health and physical health. And it includes all the coverage that Part A, B, and Medicaid, all that. It has to include all that coverage. So to be eligible for this program, you have to live in Wayne or Macomb. You have Medicare A, B, and D. You have to be eligible for full Michigan Medicaid. We'll talk about that a little later because I know there's people that are falling into the cracks with a deductible and getting auto-enrolled. We're going to discuss that in a little bit. Also, you can have hospice when you're in my Health Link, but for eligibility purposes, you cannot be already enrolled in hospice when you choose to go into my Health Link. You cannot be enrolled in My Choice Waiver or PACE and then enroll in my Health Link at the same time, and we'll talk about that later as well. And you have to be a citizen of the United States or legally here to be part of my Health Link. How long is it going to go? That's the big question of the day. Well, it's planned for 2020, and then after that we don't know, and before that we may not know because we don't know where the government's going with health care. But we should never treat the program as a temporary program. It should be taken seriously. It is a good program. And so when we look at my Health Link and we're out counseling, we should just view it as it's for today, and it's not temporary. And we'll talk about that later as well. MAP provides the state of Michigan and the federal government information on my Health Link that they gather up to help improve the quality of the program based on different issues and concerns that the counselors report to us at the main office. And also there are some MAP counselors and PIHP representatives and the state of Michigan staff on a committee called Hard to Reach. And that committee meets about bi-monthly, and we get to share concerns, things that have happened, things we need to strategize and figure out how it won't happen again. And that information, because we have a state representative on that committee work group now, will get reported to the state as well as to the federal government, which is a good thing to help improve the quality of the program. If this program remains, it could become mandatory statewide after the project is done. So that's another reason to know the program, My Health Link. Let me just add, My Health Link right now is doing very well in Michigan. We can do better, and our hope is to get back into Macomb County with some lunch and learns. We've got one scheduled for June 14th. I'll get information out where at a later date. I did not bring that with me today, but we do have one planned for June 14th. We want to keep coming into Macomb and try to share My Health Link, give everybody the opportunity to have that chance to look at the plan and help them with other things as well. Ohio, the state of Ohio, actually they are the top with this program. They don't call it My Health Link, they have their own name, but they are at the top. They're #1 leading with this project. They have very good success because they make it mandatory. So their individuals don't have a choice. It's just a mandatory health plan they have to go into. I want to remind you today that you're MAP counselors. I actually am a MAP counselor as well. And we have to remember to offer unbiased counseling. Throughout the year, individuals will come to us and they'll want help, and they'll want to help make benefit decisions, health benefit decisions. First of all, we need to screen them because you are in My Health Link County. You need to screen them and find out if they're eligible for My Health Link. And if they are, when you do plan comparisons, especially Advantage plans, you have to look at My Health Link as an Advantage plan. So when you're offering all those Advantage plan choices to your individual, if you screen them and you know they're eligible, they could fit to see My Health Link plan, then please include that information when you do your option counseling. We can't ignore the My Health Link. It is part of an Advantage plan choice, basically. There are 5 My Health Link health plans available in Macomb and Wayne, so people have a lot of choice. If they don't like one, they can go to another at any time. And then, of course, we all know there's a lot of Advantage plans, Part D choices, and a lot to offer. So we are to remain not partial to any one plan and stay unbiased. I'm going to take you through and look closer, a little closer at the 5 health plans that are available in Wayne and Macomb, and you may know them, and some of you may not. The first one is a new name. It used to be known as Fidelis, and at a recent event, Fidelis informed me that they do not want anyone using the Fidelis name anymore, that we should be using Michigan Complete Health. That replaces the name of Fidelis. It's still the same health plan. None of the content of the health plan changed, just the name and new branding. I want to just recognize with each health plan, I'm going to pull out a little bit of information. So with this one, I pulled out that if a person loses their card, they're to call their health plan member services to get a new one. And so if anyone ever comes to you and says, I can't find my health card, then just help them if they need help to find their member plan services number, which is listed in the member handbook. And you can find that online. Or they should have one, actually. But if they should not have to wait very long for the new card to come. So if they are waiting a long time and they come back to you and say, I haven't got my card yet, then that needs to be pursued a little longer because the handbook states it should be short in coming. So what do we know about Michigan Complete Health? Well, we know every plan has a care coordinator, and I put the phone number for this one for Michigan Complete Health on this slide today. It might be a handy thing to have as a tool, or you can look it up online, but if you want it quickly, it's kind of nice to have it set aside. And so that's on there, 1-844-239-7387. Now, if you have a person that's hearing impaired or has trouble speaking, they can, and they have special equipment, they can call the TTY number, which is 711. And that TTY number is the same number for all the plans, the 711. You'll see this care coordinator, her hours were from 8 to 5, or his. Also, I wanted to list out that there's enhancements with these My Health Link plans. They offer everything, they have to offer everything that Medicare and Medicaid cover, but then they put enhancements into the plan, and dental services are there. This plan has a regular exam every 6 months, an eval, and a cleaning is covered every 6 months. White wing x-ray 1 time a year. They do panoramics 1 time every 5 years. This particular plan actually does fillings and tooth extractions. Not all plans do that, I believe. And this one also said it offers complete or partial dentures covered 1 time every 5 years. This plan offers a hearing and balance test, and all the plans offer that. And there is one plan, I think we'll get to it, that offers actual hearing aids, $1,000 per hearing aid. This one offers routine eye exam and 1 pair of eyeglasses yearly, and non-emergent transportation to medical and pharmacy. And all the plans are very similar, but there are a few slight differences. Next one I'm going to talk about is AmeriHealth. AmeriHealth is the parent company of Blue Cross Complete. I don't know how many people realize that, but I actually called on this to confirm that because when I met with the AmeriHealth rep, they said they were part of Blue Cross Blue Shield. I had not heard that before, and then I did call yesterday, and they are a parent company of Blue Cross Complete. They want to know that. They also have the care coordinator. I put that up there on the slide as well today, 1-888-667-0318. Interesting enough, this care coordinator is not 8 to 5. This care coordinator is 8 to 8. So they have a little longer day. And it says there you can call them 7 days a week. I'm sure this is like a hotline. I don't know how many care coordinators they have, but you call that number. This plan, of course, has dental services, and it, again, has the exam eval cleaning every 6 months, bite wing x-ray every 12 months, the panoramic every 6 years. That's a little different than the prior one. Does fillings, tooth extractions, and complete or partial dentures as well. And the hearing balance test and the routine eye exam with the glasses once a year. And, of course, the transportation. I'm showing you these cards today. Here's Aetna. You'll notice if someone comes to you, and we get this at the Lunch and Learn, they'll say, I do not know what insurance I have. They won't say, they'll say, my health. And they're referring to their Medicaid card. So they just don't really know what they have. So we have them pull all their cards out, and we look at them. So if you ever have them in your office and you're doing some counseling, you ask them, or if it's on the phone, ask them if they see a My Health Link logo on their card. Then you'll know it's a My Health Link card. So Aetna, you can see the logo on that card. And that too has a care coordinator number today, 1-855-676-5772. And that care coordinator from Aetna is back to the 8 to 5 shift. And so everybody's just a little different. Again, you'll see dental, just about the same as the other. But this one happened to say in the member book, contact member services to confirm what is covered. Not a bad idea before you go get all your teeth pulled out. Make sure what's covered. If you receive emergency care at an out-of-network hospital and you need to be inpatient, once you're stable, you will need to move. If you have My Health Link, you'll need to move to a network hospital for the benefits to be fully covered. And that's kind of important to know if you end up with an emergency, if you have My Health Link and you're seen outside the network. But it may also be possible to get inpatient care covered at that out-of-network hospital under certain circumstances. And Aetna is the one right here. They offer $1,000 every 3 years for hearing aids, and up to $1,000. And a lot of people are looking for that. Hearing aids are not cheap. And what do we know about the Premier Plan? They also offer a 12-week session of weight management. And not all the programs do that. They offer some type of counseling for weight management. This one actually may put you in a Weight Watcher program or something like that. Then I wanted to pull out of this plan, they're over-the-counter meds. You can go to the pharmacy. The beneficiary can go to the pharmacy in some plans, and right over there, right in the pharmacy, purchase up to $20 worth of, or have them bill up to $20 worth of aspirin, antacid, foot soap, whatever you need medically, Band-Aid, you know, all that kind of Neosporin, and they'll just build My Health Link up to $20. This case, for this plan, Aetna, it looks like that they will, there'll be a form that you have to fill out if you want that to use your $20 monthly thing, and they'll ship the stuff to your home. So that's a little different than some of the plans. Here's HAP Midwest. That's what their card looks like. It sticks out a little better than some. It's brightly colored. And there's a quick care coordinator at 888-654-0706, and you'll see again the TTY number 711. HAP Midwest also does the routine eye coverage with the glasses. They have the yearly hearing and balance test, and which are basically what your Medicaid and stuff would cover. The plan will pay for one-time expense. I added this in. This is somewhat similar in all the plans. Plan will pay for a one-time expense to transition from a nursing home to another residence, where the person is responsible for their own living arrangement. So if you wanted to transition from the nursing home, you wanted to go to your sister's house or your own house, it will cover some things. You must have been 6 months in the nursing home for this to happen. And then the coverage may include your housing deposit, utility hookup, furniture, it's limited, appliances, that also said limited, moving expenses, and so you'll find that in the other plans as well. Now, I brought the front and the back of the Molina card up. It's a little blurry, doesn't copy off online very well. But the reason I did that is we had an issue a while ago that one of the health plans, and I don't think it was this one, but one of the cards on the back had behavioral health first. And there was concern that if I'm having a crisis or I need to call something right away, and it's not behavioral health, the first thing that you see on the card is behavioral. And they thought that should be reorganized on the back of the card. This particular card, it says you call your member services, your number up there for member services on the back. And then there's a crisis line listed on the back of the card, 24-hour nurse crisis line. And then you've got your behavioral health services and a crisis line number. And then it also adds, if you need to send a claim, let's say you got a bill. You should never get a bill in my health link, and a bill comes to your house, and you're capable, and the beneficiary is capable of sending it in. They should mail it back in to the health care plan to pay. They should not pay the bill. So there's a little address on there for that. And there's also a pharmacy phone number as well, help desk. So those are very helpful numbers on the back of all the cards. You would find that. Care coordinator's number for Molina Health Plan, 855-735-5604. This person's shift, we're back to 8 to 8 during the day. And what do they all have in common, the health plans? Again, they cover your physical and your behavioral health. Some offer, they all offer the same services as Medicaid and Medicare with the extra enhancements. The important thing to tell people is there's no co-pays, no deductibles, and there's a care coordinator. So this person is to oversee all your needs and make sure these things happen. And then there's also transportation, non-emergency transportation. And every plan is a little different, but my standard rule for the transportation is if you wanted to be transported, you call, 3-4 days at least. 4 is good before you need to go somewhere. There's other enhancements, dental, vision, hearing, and weight management, and the big deal is you get to carry only one card. However, if you go to Lunch and Learn, people call a lot of cards. Past cards, present cards, they have so many cards, and to try to help someone sort those out is a little difficult. I think they don't really want to part with their cards. So, but the bottom line is if you can get them to understand, they should really, and it'd be so much less confusing if they just carry one card and lock away their social security, their red, white, and blue card and their Medicaid card in a safe place, but kind of hard. Beneficiaries must use network providers and network pharmacies, and that is probably one of the top issues when you try to counsel someone with My Health Link, because there's a lot of older individuals that love their pharmacy, they love their doctor, and they don't want to change unless their doctor is in the network. So network providers have agreed to accept payments from the health plans that I've all listed today for covered services as paid in full. Providers include doctors, nurses, healthcare professionals, clinics, hospitals, nursing facilities, home health agencies, durable medical equipment suppliers, waiver service providers, and long-term services and providers. Network pharmacies are, your drug stores that have agreed to fill prescriptions for plan members. And so it is always important when you're counseling people, and if they do have mild health links or they're considering it, to remind them, if they do, you know, make sure you look every year, every new year, to make sure your provider still accepts My Health Link. And make sure you look every year to make sure all your drugs are still there, and you can still go to the same pharmacy, because sometimes pharmacies drop out, sometimes providers drop out, just like anything else. So it's good to always check in the new year to make sure that you're still covered in those areas by your doctors and pharmacies and hospitals. Behavioral health is for things like intellectual, developmental disabilities. I'm going to throw out a couple of things. Schizophrenia might be a behavioral issue. Major depression, minor depression, mild depression, bipolar disorder, and then also the really nice thing is My Health Link covers substance use disorder. That's drug addiction, basically. And here's some numbers for that on my slide today. Macomb County for general information, and the PIHP is the let's see, prepaid inpatient health plan. And they are the ones that got the contract for My Health Link for behavioral health. They can subcontract to the local CMH if they want to, or they can use other providers. They have a little more flexibility with this plan with their folks who are on Medicaid. So anyway, so you'd call the PIHP if you needed general information. Even as a counselor, you could feel free and ask them anything you wanted. You just call this general information line if you want to find more about who's your providers, is there any things we should watch out for, they also have free interpreter services for people who don't speak English. So Macomb County's number's up there. It's 1-855-996-2264. And then Wayne, it's 1-800-241-4949. And there's a TTY number up for Macomb, it's 711. The TTY number for Wayne was a little different. It was 1-866-870-2599. These calls are free, and feel free to call as a counselor too if you have questions. There's a crisis line as well. So if a person's in crisis, and some of us, I've always wondered, because I work for community mental health over 20-some years, and I see people in crisis, and I'm thinking, how do you call when it's difficult to call when you're in crisis. So, but it's a good thing too. So here's the crisis line. They have a separate crisis line phone number, and Macomb is 1-855-927-4747. And, I'm sorry, Macomb. And Wayne is 1-800-241-4949. Macomb, again, uses the 711. Wayne uses the 1-866-870-2599. And these numbers, I would just keep there. That is your behavioral health, which is Detroit Wayne Authority, Community Mental Health Authority. That's your PIHP, and so those numbers should work for any health plan that you are in. Those are the numbers you would call. Here's a warning, though. When I was looking for numbers, and I did some checking and did some phone calling on my own, I found a couple problems, which I haven't had time to report. But I want to tell you, if you have someone that's in AmeriHealth and they're looking in their member handbook, and they find the PIHP number, it's not right. It is listed wrong in the member handbook for AmeriHealth. The book lists a 2265, and it should be 2264. I believe when I called that number, I got Farm Bureau insurance. So that's a little problem. And then it happened again. So I'm not done checking all my numbers after this presentation today. I'm going to continue to check. Aetna has listed the wrong number for the Macomb Behavioral Health Crisis line. It says it is 273-8255 in the member handbook. What it should be, 273-855-4747. And when I called the wrong number, it gave me something like this number's is out of order or something like that. So, and I called the other number, and I got the crisis line. And I was in crisis because it's the wrong number. So Some beneficiaries just don't know, and I want to remind you that, and you already know this, I'm sure, that they just don't know what they have. So here's a couple pictures of the cards, and we get this at the Lunch and Learn a lot. They think they've got My Health link when it's My Health card. A lot of folks, when we're talking about My Health link, oh, I got that, and then they show their card. No, you have My Health card. That's your Medicaid card. It's a little confusing. The My Health link name probably isn't the best name for the program, but it's done. Beneficiaries often don't know what they've got, so our job as counselors is really help them figure that out too. They seem to not be so stressed, and we can lay it out and assure them this is what you have. So it's kind of important to know and help them work through that. And then again, tell them these two cards, they can set them aside. If they enroll in My Health link or they have My Health link, they don't use these two cards, and it's important to kind of stress that. They use their My Health link plan card. Enrollment. Enrollment's been an interesting issue, and it continues to be interesting. An individual may be auto-enrolled, and this happens every month now. People are auto-enrolled, and they will be auto-enrolled, possibly if they need eligibility. And auto-enrollments are done by the state of Michigan. The state of Michigan goes in and they pull all the eligibles that the machine says that's tagged them as eligible, and then they put them all together and they send them to CMS, federal government, and they look through them and they kind of clean them out, and then they send the group back and they say, okay, ready to go. And those are the people that get enrolled. They get little markers, little tags on them, and that's how they figure out who's got what, and that's who gets pulled. And they're doing it monthly. An individual, if eligible, always has the option to enroll. Even if they don't get auto-enrolled, they always have that option. They'll go into My Health link, and they can call Michigan Enroll to sign up for it. Auto-enrollment, I want to talk a little more about that. I just mentioned they're passively enrolling people. Sometimes, I would say on average, anywhere from 700 to 1,000 a month get auto-enrolled. And I can't break that down for your region, your county, but I know that your county has a lot of folks eligible, as in Wayne and Macomb both have a lot. Wayne, of course, has more. They pull these, and the reason they determine the auto-enroll by maybe they had a birthday and now they're eligible. So they're going to pull those that had the birthday, turned 65, and they have Medicare or Medicaid, full Medicaid. So they tag them as such. And then those individuals who might have just moved into the demo region, they might have moved into Wayne, Macomb, and they have dual eligibility, they too are going to probably end up one of these months auto-enrolled. They will get a 30-day letter. I don't have this on the slide, or they'll get a 60-day letter first that says you've been auto-enrolled. Then they're going to get a 30-day notice, and it's going to say in there, you're auto-enrolled, and maybe they put you in Molina. And it's going to be effective May 2nd. And you've got this much time to change your mind. Well, don't take till May 2nd. Tell your beneficiary, if they're talking to you about it, don't wait till the last second. Really, it's best to get them switched a couple weeks before so everything can transition smoothly. And we know that, they can go back to their plan that they had, or they need to get enrolled back in the plan. Make sure all that's taken place and there's time so they're not without a gap. We have had a few issues with that. I had one actually coming out, wanted out of PACE, wanted to go into My Health link, and she was auto-enrolled actually, and it was going to start May 1st, and she wasn't going to, or I think she was not going to leave PACE till the 30th. No, it wasn't auto-enrolled. She wanted to pick it. She wanted it effective May 1st, and she was going to get out of PACE. So you got to get out of PACE and disenroll before you can enroll in My Health link. So she was going to wait till the last day of the month and enroll in My Health link, which means that's the next day. Chances are that's going to be a problem. That's just too close. Auto-enroll. I might have included that in one of my scenarios, I'm not sure. A beneficiary calls the counselor this is a scenario, and they were stating they had disenrolled and just received a letter stating they had been re-enrolled. This happened twice to this person, by the way. I didn't put it in the slide, but twice this happened to the same person. They got out, and then they got put back in, and they got out and put back in. And they don't want my help link. And then what should they do? So it's important to get them to call Michigan Enrolls again, and if they are not able cognitively or if they need assistance, the counselor can help them do that. They can say on the phone, I've got my counselor here, that counselor, I give them permission to talk to you, and you can help them do that. I know during Part D, it's a busy time, and we don't want to be, we try to let people that can do this themselves. So guide them to Michigan Enrolls and have them disenroll again, and also at that time, opt out. You want to disenroll and opt out. This little thing on the slide, I took it from the Advocate's Handbook of the Ombudsman, the State of Michigan Ombudsman for My Health Link update. And I pulled this out there. It says, it should be noted that individuals who were previously passive enrolled and then disenrolled before they entered My Health Link may still be caught up in the next wave of enrollment if they did not also opt out of the program entirely when they disenroll. So chances are, the individual that had called and then put back in a couple times, when she called and disenrolled, which she did, she probably didn't know she had to also say, just opt me out. Because that takes you totally out of it. You can still enroll anytime. You're just not going to get caught up in auto-enroll anymore. You're just saying, I don't want anything on it right now. Maybe down the road, but I don't want to be caught up in all this. It's only all the way out. And so that's an important thing to remember. There's another scenario. The beneficiary calls MAP counselor and states that they were auto-enrolled and they have a Medicaid deductible. That's happened quite a bit. I don't know how many of you have seen that, but we've gotten a few calls on that. This is an ongoing issue. This is the second time that it happened for this beneficiary. And what happened was they have some back bills that actually they apply for their Medicaid, then they meet their deductible. So then the switch gets turned on in their tags. They look like they got full Medicaid, and they get pulled into the auto-enroll. And then as soon as they don't meet that deductible anymore, they're dropped, and they don't have My Health Link anymore. That's a big problem. And so we think we got it fixed. But here's some things. The counselor can collect the beneficiary information. The MAP counselor can collect that and send a secure email to myself, Judy Hazle, or Linda Kushner at MAP Central Office to investigate that when that happens. Another option is to have the beneficiary call Michigan Enrolls and ask to speak to a supervisor about the situation. And the reason I suggest you talk to the supervisor, if it's not just a general enrollment, disenrollment thing, there's a lot of new staff in Michigan Enroll. And I know that as time goes on, they're getting better trained. But I would suggest to speak to a supervisor in that situation. The third option is to contact the My Health Link Ombudsman. And just to remind counselors today that you're here to counsel, you're here to give unbiased health care options. The beneficiaries, they want help to sign up and figure out what they want to take and what will fit best for them. And that's kind of our job. It's not necessarily to take these big problems on, but yet we all want to help. And, a lot want to help. But I do want to, there's no problem. I think a good thing to do is to either give it to the ombudsman if it's a serious problem, or Linda or myself, or if they're really capable, let them call Michigan Enrolls, suggest they do that. We have had people do that, and speak to a supervisor. The state of Michigan thinks they have it solved. At the last meeting I went to, there's enrolling people that have a deductible. They thought they had it fixed, and then I got a phone call. So I had to tell them, we got another phone call. So I think there might still be a glitch to that, and we're really trying to get that so people with deductibles just cannot participate in my health link. Scenario 3, there was a son who called Michigan Enrolls. Now this was earlier when Michigan Enrolls was adding new staff. They were gearing up for a lot of calls, and they had a lot of calls, thousands of calls a day. And he called for his mother. She was deaf, and so she was in a nursing home and wanted to enroll my health link. And Michigan Enrolls told him, well, you can't be in a nursing home and have my health link. Well, that was wrong information. So I just want to make sure that everyone's clear today. You can be in a nursing home and have my health link. And granted, some of the nursing homes aren't too excited about that, but I think they just don't understand my health link. So the MAP counselor in the area called the MAP central office and shared the situation. It was investigated, and the investigation, we found out that all these new staff had come on to Michigan Enrolls, and they just had not been given the correct information. And so when that happens, sometimes it's helpful if you had a call like that to take down their name, like maybe the son's name who called, the mother's name, and get some detail so we can share it with Michigan Enrolls, and they can go back and look at the phone record, and then they can see who talked to that person in Michigan Enrolls, and they can give them the correct information or give them some additional training or whatever they need. They can't fix the problem without that additional information to be able to go and figure out who took that call. So the call volumes were high earlier, and they may get high again. I actually tried that myself one day, and I had a 40-minute wait. So probably the best thing to do is continue to suggest people to call maybe later in the week. Don't call on Monday if you can avoid it, and maybe in afternoon. There's enrollment through Michigan Enrolls. You would call there to enroll and to disenroll, to opt out. There's the number on my slide. Disenroll a person, again, I want to reiterate, a person has to call Michigan Enrolls and ask to be disenrolled to leave my health link if you have my health link. You got to call and ask to be disenrolled from your plan. Now, if you want to kind of switch plans, you can do that too. I didn't put it into this slide, but you call Michigan Enrolls and say, you know, I don't like this plan, but I want to try this plan. I don't like Molina, I'm going to try Aetna this time. And you can do that every other day if you want. There are no limits with my health link. Sounds a little crazy, but it's true. No limits, yes.
I was wondering about that very thing for somebody who might find out they need hearing aid services if somebody wants to transition from the nursing home. Let's say they're in one plan and they know that the other plan is going to cover those costs. Can they just go ahead and switch over to the other plan and have those costs covered and then switch back to their other plan again?
Well, they can. I don't think there's no rule that says you can't. I mean, you don't have to tell them why you're switching, you know. And so basically the bottom line is you can switch on Monday and switch on Friday and switch again, you know. And there's just no, it's open. It's much different than, you know, what we're trained as MAP counselors for the other health plans. So the switch is effective immediately? It doesn't wait till the following? No, it's not. So I'll get to that slide. I think I have that in the slide. It's that 5-day thing before the end of the month, and I'll cover that in a minute. Good question. So again, though, if you're going to disenroll from the plan, make sure if they don't want to be caught in an auto-enroll that they say, I want to opt out. Opt-out takes you totally out. You won't get mail on it. You won't get auto-enrolled. You have to do those steps. But no matter what step you take, you can always call and get back in. Nice thing about the plan. And there is a form online I want to point out to allow someone to speak on the beneficiary's behalf. You may have a beneficiary that might need more than one call, and they might need your help. And I would recommend that maybe you pull the DCH form 1183 up, and I believe it might be in SHIP tools. I have to check that, but I'm pretty sure if it's not there, I need to get it there. So it's DCH 1183. They fill it out. The thing is, they don't send it in to DHHS. It has to go back into DCH. and it does take a few days, like 10, 12 days. So if you want to talk to someone, have a MAP counselor, if the beneficiary wants a MAP counselor to talk the very same day, then they would want to say, hey, I've got the counselor here, I give approval to talk to them, and it's only good for 1 day.
DPH stands for?
Department of Community Health. All right, here's another scenario on enrollment. If a person has, well, actually, if a person has My Choice or PACE, they can enroll in. Can they enroll in My Health Link? You can't enroll while you have those. You have to disenroll first. And there is concern that when you do that, you're disenrolling from My Choice or PACE. You disenroll, and then you're going to enroll. You want to make sure there's no gap. So we went through this in the past week, and so what was told to me is make sure, have assistance from Michigan Enrolls on that. Speak to a supervisor to get some guidance on how there will not be a coverage gap. I think it's going to be in timing. Timing is going to be important on that. I would also say if the person has My Choice or PACE and they're considering dropping those and going into My Health Link, it's really important that they know if they come out of those programs, the My Choice waiver or the PACE, to get back in. If they don't like My Health Link, go back in. There's a really good chance, especially with My Choice, they'll be on a waiting list. So, so we don't, we always just point that out. Here's another scenario on enrollment. If I receive private duty nursing more than 16 hours a day, am I covered by My Health Link if I enroll? I took another piece out of the Advocate's Handbook. It said private duty nursing is only available 16 hours a day under My Health Link. If it's more than that, you can't qualify. Individuals in My Choice who currently require private duty nursing more than 16 hours a day, they should not opt into My Health Link. So that might be a counselor note there. Remember that. It's extremely important that these individuals remain in My Choice where the full extent of their need for private duty nursing can be met. So that's probably a good thing to know. Another scenario, if the beneficiary, or question, if the beneficiary is in My Health Link plan and does not like it, answers your question again. They can switch if there are other plans available at any time. The Upper Peninsula only has one plan, and actually they do really well because there's only one plan to pick from. Where here in your counties you have 5. So, so they basically they can't switch in the UP. They don't have anywhere to switch to. So here's a question. I thought your Part, somebody asked this, actually it was a counselor that asked this, I thought your Part D and extra help followed you into My Health Link plan, and that plan added extra benefits like no copays. There was some confusion, and My Health Link is an all-inclusive plan. So when a person enrolls in My Health Link and they have Part D, they're going to be enrolled from Part D. You can't have Part D and be in My Health Link. The Part D will be you'll be disenrolled from that, as well as you cannot have extra help. That's a Medicaid program. You can't have extra help because you can't have the 2 Medicaid plans at the same time. And My Health Link is basically a Medicaid plan, so to speak. So if you go into My Health Link, think of it as an inclusive patient. Everything's included. And so that other stuff you have has to be taken away. You can't have that other stuff, all inclusive. What if the individual is auto-enrolled and does not disenroll or opt out by the deadline date in their letter? If the beneficiary is auto-enrolled and wants to disenroll and opt out, that's fine. And they miss the deadline, they will be enrolled officially into My Health Link if they don't get out of it before that deadline date. They're going to find that all of a sudden they got this 30-day letter, it says I'm going into Aetna May 2nd, and it's May 29th, and May 30th, and May 1st, and they forgot to call, and they're going to have that now, at least for a good month until they get out of it. So they can pick another plan, or they can call and disenroll, but they may have to wait a month. There'll be a slide on that, I think. If the beneficiary wants to change the plan, keep in mind if the beneficiary changes health plans, there is a timeline, and here's the timeline that you asked about. If they call Michigan enrolls at least 5 calendar days before the last day of the month to go into a different plan, their different plan will be effective the first day of the next month. So if the beneficiary calls during the last 5 days of the month, then they're going to have to wait till the following month. You've got to skip a month, and then it'll occur. When you're counting days, though, it can be a little tricky. It's calendar days, but you got to remember that Michigan enrolls is closed when the state is closed. So they're not open on Saturday and Sunday, and they're not open on holidays. And I think we have a holiday coming up, Memorial Day coming up. And so you won't count that Memorial Day as one of your days, and you won't count the weekend that's attached to it. You have to count back 5 days, skip over those closed days, and keep counting. And don't do it on the 5th day. Do it the day before that 5th day. So that's kind of important. And we've had a few people that have had to wait a month because they did not quite understand that. Here's a slide I thought I'd throw up there. Transitioning. If a person wants to go into My Health Link, here's something as a counselor you can share, is if you are on a waiver, you can maintain any of your current providers at the time of enrollment for 180 days, or you can continue with single case agreements if your provider agrees to do a single case agreement. The health plan must honor existing plans of care and prior authorizations until the authorization ends, or 180 days for the enrollment ends. You got 100 days. That's a big transition period, I think, to be able to either look for somebody else. That's really nice, actually. And then anybody else on My Health Link, when you're transitioning, you can maintain that current provider. They give you 90 days to have the care coordinator help you find somebody else. They really want My Health Link. They love the plan. No deductibles, no bills. It's the perfect plan for them, but they're not quite sure how to find a provider. The care coordinator is supposed to help them, and there's 90 days to make that transition. What's the care coordinator's role? Ultimately, they're responsible here. There's quite a big responsibility on the care coordinator. As a part of the person-centered focus, each My Health Link enrollee will be assigned a care coordinator, and once they're enrolled into My Health Link, there'll be, I read one member handbook, although I'm always told that it's like a couple weeks, 10 days they should be calling. One handbook did say your care coordinator will call you within the first 45 days. And that's to probably get your assessment, because once you go into My Health Link, there'll be an initial assessment to see what needs and care you need. And there may even be another assessment needed if you need some other, like home care and other things. There's different levels. So the care coordinator is charged with working alongside the enrollee to create a personalized care plan, and it's tailored to that enrollee's health needs and goals. The care coordinator's role is to advocate for the enrollee, help answer questions, concerns, connect the enrollee to necessary support, actually help them get transportation, things like that, help them find a dentist, all of that. That's what the care coordinator is supposed to do. If that is not happening, and counselors, if you hear that not happening, somebody says, well, I don't even know my care coordinator, they've never called me, I tried to do training, nobody's helped me, then that needs to be reported to the My Health Link Ombudsman. The Ombudsman we currently have are lawyers, and any time a health plan is not meeting their contractual agreement, giving what the individual needs and has been decided upon, then that needs to be reported to the My Health Link Ombudsman to follow up. Deeming. Deeming came about at the state of Michigan, we got a new director of integrated healthcare, and the first thing she did was realize we had trouble because people were getting bounced out of my health link because they didn't do their redeterminations on time. So the new director with a committee got this deeming process going. So what that means is they receive, a person on Medicaid, a dual, receives their paper in the mail. It's a redetermination. They're supposed to turn it in by a certain date. Well, lo and behold, maybe your beneficiary has Alzheimer's and they threw it in the mail, and their caregiver hadn't had time to go through the mail and figure it out. So now they got a situation, they don't even know when it's supposed to be back or anything like that, or they just get the stuff in the mail and they don't realize the importance because all these envelopes kind of look alike and they just throw it away. Think, another thing from the state or whatever. So that happens a lot, actually. There's several people in deeming. Deeming gives people 90 days to still be covered by the health plan, their My Health Link plan. That doesn't mean if they're past that deadline date of getting their redetermination in, basically they don't have Medicaid, okay? But it gives them that 90 days to get it all squared away and get it back. So in that time of 90 days, the health plan is going to pay for all their services, except for behavioral health. This is physical health. It's going to take care of their needs. The health plan agreed to it, and while they're trying to get their Medicaid hooked back up and get that all straight and get their paperwork in. They got 90 days to do it. Behavioral health, the PIHP said, we're not going to do that. If the person doesn't do their redetermination, we're not going to cover their services. However, that's not totally true because they will try to help as best they can for the behavioral health piece with their general fund dollars. They have other dollars they can help pay for these services. You know, the general fund dollars are small these days in CMHs. The Medicaid money is what they work off of, a lot of it, a lot of CMHs. But if they have general fund dollars, they will try to help cover those services for that person needing services during that deeming period. But that's important to know, probably as a counselor, I think. Here's a deeming scenario. There's a blind man in a nursing home, and he just plain decided he wanted to go home, and he just walked out. Didn't sign a paper or anything. By the way, it left him a bill, and because he didn't sign out of there, so he's got some money he owes. He had been mailed redetermination paper. It was founded as we did discovery in January. Then in February, he got mailed a notice that he didn't turn his paperwork in and that his case would be closed, his Medicaid case. In early March, he left the nursing home, but even today, he still shows active on CHAMPS as living in the nursing home. And the My Health Link plan is still covering him this month. Nursing home, the caseworker, the Medicaid caseworker, they closed the Medicaid case, and that's been investigated. That is true. So what should have happened is, at the least, according to our MAP Medicaid specialist in the MAP office, the caseworker should have put the individual on Medicaid with a spin down, and that is because he was full Medicaid and qualified for My Health Link in the nursing home because the asset level and everything is higher. You can be on full Medicaid. When you get out of the nursing home, that changes, and this gentleman was like about $40 above federal poverty level, so he didn't qualify for full Medicaid outside of the nursing home because it's a different base that you follow. So he actually has Medicaid with a spin down, or he will. He needs to get enrolled back into it, and unfortunately, he's going to have to do that because the caseworker didn't just do it for him. So, and of course, he will not have My Health Link. So the caseworker, again, should at least put them on a Medicaid with a spin down, and they could have worked with that, the people, the AAAs that were working with them. Oh boy, good question. I'm not sure. It's a financial system. Oh, she would like to know, what does the word CHAMPS stand for? we'll write that and I will get that out to you so that you know what CHAMPS is. It is a financial system that I know that much from working with CMH, but I'll get you what the acronym stands for and get back with you on that. Sometimes the systems don't line up, and so sometimes that's a discovery that we can find at the MAP central office when you give us cases, and we can actually get them all fixed working with our DCH contacts, or DHHS contacts. Long-term supports and services are covered under My Health Link, and they're available to members who are on certain waiver programs. There are waiver slots for My Health Link. The person has to be assessed and be put in those waiver slots. The care coordinator could help determine that and help someone get into a waiver slot if they meet the level of care. There are state eligibility requirements. Member on different waivers, what they could get would be personal care, equipment to assist with activities, tour services, home modifications, adult day programs, private duty nursing, preventative nursing services, respite, home delivered meals if you qualify. Most plans at least 2 meals. I know there was one meal that upped their, or one plan that upped their meal to 3 meals a day now in 2017. There's community transition services, physical intermediary services, personal emergency response system, nursing home care. So there's all that. With My Health Link, this is a great thing. There is no 3-day hospital stay prior to going to a nursing home. If you have My Health Link and all of a sudden you need to go to the nursing home, you do not have to have a 3-day hospital stay. You can go right in. We have a partner that helps us with lunch and learns, and I want to bring that up with the counselors because if there's any outreach being done in your areas, a lot of times MDRC will have outreach specialists that will contact you, and they'll want to go in and they'll want to do something at the senior housing unit or something, at a library, but they don't want to do it by themselves. They like to bring MAP in with them because we do the client cases. They don't do that kind of thing. They just share information on My Health Link. They don't help with enrollment. They don't help with any of the stuff that you do. So I listed their names in case you ever come across them. That's what they're doing. They got a piece of the outreach grant for My Health Link, and they're out there doing outreach, just telling people about it. But they really like MAP at these events. So if they ask you, and that's why they're asking you. So Macomb, there's Louise, and her phone number's up there. They're Lakeshore Legal Aid actually are the ones that help in Macomb. Louise, Verbecky, Elaine, Hearns, and Renee Kovalowski, I believe. So in case you run across them asking if you could do an event with them or something. Wayne County is Shell Freeman, Antonia Harbin. They're already helping quite a bit with our, actually I think the above are too, with our lunch and learn. And they're kind of our partner on lunch. MDRC, Michigan Disability Rights Coalition, is one of our partners in these lunch and learns that we do in the My Health Link region. If a beneficiary gets a cancellation letter saying Part D is getting canceled, they should not be concerned. Again, I want to remind you because they don't need it if they have the My Health Link plan. If they already got drug coverage in the plan. Full, no deductible, nothing. Full coverage. Here's a slide, continuing your home health provider. That's a concern sometimes. We run into that with talking to beneficiaries in counseling, in doing plans, comparisons and things. They get concerned that they might have to lose their home health provider, and some of those folks are attached to their home health provider. So they don't necessarily need to lose their provider. Health plans must allow the enrollees to choose who they want for their personal care providers, the home health provider, including paying family members or friends. The health plan has to do that if that's who they want. I believe, though, it can't be like if you're the wife and you're the home health provider for your husband, it can't be quite that close, I believe. I'm going to have to look that one up to double check on it.
If they live in the same home.
Right, I believe that's right. Yep. So there can be that can be worked out. They don't have to use their home health provider. That's been a big concern of some people. Hospice is new. In a little before 2017, I got all excited about this. That was another concern because you couldn't enroll in My Health Link. That it wasn't covering hospice. Now My Health Link does cover hospice. So let's say you go into, well, you don't even have to be in the nursing home. Let's say you're at home and they put you in hospice and you've had My Health Link. You keep your My Health Link. They just do all the paperwork that needs to be done. And you can have My Health Link along with hospice services. Transportation, I brought this up again. Transportation in every member handbook, some say call me 2 days before, some say call the care coordinator, some handbooks say call member services. It might be just easiest to tell the individual call member services and they can redirect the care coordinator on the transportation instead of trying to call two different things to get your transportation set up. And that is provided services in the contract, and so if that's not being provided and that's a problem and people are getting frustrated over their transportation because they've called 4 or 5 days ahead, it was supposed to be lined up and all of that, they can call the My Health Link Ombudsman because that could possibly be a violation of the contract. I put the provider sample up here. We had a time where providers weren't coming on board, and I had MAP counselors saying, I spoke to this provider and they said, we're not going to, we're not coming on board with My Health Link. They never pay. We're getting out of that. Well, at doing some research, there's quite a lot of detail on who they should bill and how they bill. And so I put a little sample up here. I grabbed Aetna's out of here. And it shows, just so you know, if any provider ever says that to you, well, you might refer them back to their health plan website and go into the provider area because there's great, really good detail on how a provider should be billing. And it can be tricky. So some let you bill electronically, some don't. And then they give you address and they'll mail hard copy claims to that particular department. And we were finding they were mailing to the wrong department. They were actually mailing, instead of Aetna Better Health of Michigan, I just use this as a sample, they would send it to Aetna, their regular health plan. Well, Aetna Better Health is the Medicaid, it's a My Health Link plan. It's not the same as Aetna regular health. So that's why a lot of claims weren't getting paid. They were mailing it to the wrong part of the plan. So all that information is online, and I would certainly, if that came up, refer the provider back to that, because they will pay. That's not a problem. It's just got to be billed correctly. What if a beneficiary receives a bill and they're on My Health Link? They should absolutely not receive a bill ever. If they do have the choice of mailing it back to their health plan and say, hey, pay this for me. But maybe one of the easier ways might be just call the My Health Link Ombudsman and ask them to assist. So that's another choice. They never had a concern that a lady said she kept getting a bill and she wasn't going to pay it. She's on My Health Link, but then she started getting collection letters. So that's, before that happens, or if that happens, I would still take it all to the ombudsman to deal with. Yep. Resources. A great resource, and I don't know how many counselors use this with My Health Link, or let's say you don't usually counsel My Health Link, but during Part B time, or during someone comes in and wants to do plan comparisons, what's available to me? And you're showing them, and you're not really designated as a person to know everything about My Health Link. You still need to know something about it because you're obligated to share with everyone all the plans. and yet you didn't have some training and stuff, it's so easy to go into Michigan.gov and to their My Health link. Just type in My Health link, it'll pop up. They got a full page, and you just click, 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 and you'll find everything you need on that Michigan.gov MDHHS site if you plug in My Health link. All kinds of things. In fact, I found this document that I found really interesting. You may not, but I like to read. So, minimum operating standards for My Health link. And I got in there and I realized, wow, these are all this has to happen. This is minimum operation that has to happen for people with My Health link. And here's a sample. The minimum operating standards for My Health link program and My Health link HCBS waiver are available on the site. It says, page 23 of that booklet said the ICO must provide adequate hours of service to meet the enrollee's needs even when that goes above the reasonable time schedule. The need of the enrollee must be met. It's right there. If the enrollee's needs go above the reasonable time schedule, the ICO must add justification, verification, the assessment, and all that kind of thing. All the basic stuff is right there. There's some more stuff. Shopping was on there. Compiling a list. Shopping was defined as compiling a list, manage cart or basket, identifying items needed, transferring items to home and putting them away, phoning and picking up prescriptions, limited to brief occasional trips in the local area to shop for food, medical necessities, and all that kind of thing. And this is how they decide on level of care. That's what this was, level of care. So they're doing an assessment to see what you need, and they're looking at your shopping area, and they say, oh, you don't need assistance, you're a 1. And then they might say, oh, you're totally dependent on somebody for shopping, you're a 5. And there's many more screens like this in that booklet that show how they get to the point of determining the level of care for the individual. It's all in that book. Here's the advocate guide. This is a wonderful guide. You go in that guide with your mouse on your computer and you click on the index and it just takes you right to the page instantly. So it's like a matter of just click, 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 and it just takes you wherever you need to go. You can type a search word in and it will just fly you right to where you need to be in that guide if you have any questions on My Health link. And that is also found on that Michigan.gov website. And at Michigan Elder Law, they have a piece of the My Health link grant too, and they update this regularly. And they are also a partner in our Lunch and Learn. Here's a sample of the Advocate's Guide. I took page 24, and it's about that Part D thing again, because there was so much confusion with one of the counselors on it. Enrollees cannot keep their current Part D drug plans, and it goes on to talk about that. At our Lunch and Learns, we give out a piece of paper, and you may find it helpful as counselors to either, you could email me if you want it for your area. I think this one was made for the county of Wayne. So, but it probably fits Macomb. Yep, I'm sure it does. Macomb as well. It gives all the phone numbers. Michigan Enrolls, the Ombudsman, MDRC, and there's a Medicare number for questions about Medicare enrollment and coverage. So we give those to everybody that comes to Lunch and Learns, all the potential eligible people and the eligible people. Kind of handy. There's other tools. Part of the My Health link grant asks that people, AAA, they do some outreach, and that can be done in whatever way the AAA decides and the counselors. And I know that this, Wayne, they have a lot of different tools they use. They've done placemats. I think they've probably done press releases and all that kind of thing. There's a lot of resources, and we can share those resources on Ship Tools. You'll find some of those. And just talking back and forth, you'll find some good tools. I'm going to show you something today that if you wanted, I don't know if you ever go out in the community and do a PowerPoint, but I do want to show you this. This has been showing up on social media for MAP. It's one of several little video clips we've been using MAP Central for money there for. And this is Joe Murphy, Executive Director of MAP. And she did a little video clip for social media. So we're going to play that. I think we're going to play that. Oh, let me play it from mine. A little tricky. Good point.
My name's Joe.
There we go.
I'm here to talk to you about a new Medicare option. If you have Medicare and Medicaid and live in the state of Michigan, you may qualify for this new program. With this program, you'll get a care coordinator, you'll get your hospital services, your doctor services, extra services like transportation to appointments, help, getting your appointment to see a dentist. If you qualify, you may get in-home services as well. This program combines all of the benefits that you would normally get from Medicare and Medicaid and more. Please call 1-800-803-7174 to talk to a MAP counselor about the services from the Michigan Medicare and Medicaid Assistance Program.
We've made several video clips. If you ever do a presentation with a PowerPoint and you want to insert one, just let us know and we can share that with you. MAP reporting, real quick, I want to remind people, when you get PAM forms and you're out there doing fairs, health fairs, or you're going to senior high-rises, whatever you're doing, and you mention My Health Link, and it's a good idea to just mention it since Wayne and Macomb are part of the regions of that. Include that on your form. So don't just say, hey, I went to a health forum. At your table, actually, you can do all your MAP materials, volunteer brochure and your MAP brochure, but you can also do a My Health Link brochure and leave it on your table, and that will count as outreach. So, but you should include it when you fill out your PAM form. That should be included on there. Just handwrite at the bottom on the back side as you're checking off boxes. If there's not a spot, write it down My Health Link so that they know you also mentioned My Health Link on the PAM form. The reason that's important is, let me explain, when we get PAM forms at the MAP main office, they come in and they go to our assistant executive director. She goes through them. She sends them to Susan, who does all this reporting. Well, we're not done at Susan's desk. They come back to me, and then I have to take them, and I have to make a list of all the outreach you did for My Health Link, and I have to turn that into the state of Michigan to Mark Cooley, who oversees the contract for My Health Link, and then that gets reported to CMS as well. That shows whether we're doing our job or not at MAP. So the PAM, filling those out are really important to include My Health Link when you can. SHIP tools, was also some question. I see numbers are really low on SHIP tool reporting of My Health Link, and not just in these 2 counties, but all the counties. And I think there may be some confusion on how to report in SHIP tools, and there is a non-mandatory area on SHIP tools that says My Health Link. So if you've mentioned My Health Link, go in and click it and fill it out to your best of your ability. If you have a question, call me. I can help you walk through how you should fill that area out. I didn't do that today, but I can help you understand how to do that. So it doesn't necessarily perfectly fit a walk-in that you share with, it's a little, it's not a perfect fit for a form. So, and then also, when you're doing plan comparisons and you're in Macomb or Wayne, and you screen somebody and you know that they're eligible, they could be eligible for My Health Link, and you share those My Health Link plans along with other Advantage plans, My Health Link is to be considered an Advantage plan when you're doing SHIP reporting. So go under that Advantage plan area and fill it out as My Health Link, for My Health Link. And that will help our numbers show to be accurate, more accurate, I think. There is a My Health Link release form for personal stories. We're always looking for personal stories. When you're out in the field and you come across somebody that really likes their My Health Link, we would like to know. So because we can use that to do outreach with those stories, we can't use them if we don't get a signed release, though. So I know the state was pushing me last year, pushing MMAP to get those and find stories. And so if you come across someone and you need to find the form and you can't find it, it should be on ShipTool. It's a release form. Call me, that's fine. Contact MAP at 999-0681, and we'll make sure you get that form because I think MDRC, Michigan Disability Rights Coalition, has some stories out on their website now, but we could use some from the MAP point of view. And not the bad stories, just the good. So now, I know I did a lot of talking, probably some of it's pretty boring, but now if you have questions, I want to open that up for any other questions. And I will tell you that if I don't have an answer, we will record the question today, and I will get back to you. So clearly identify yourself so I know who to get back to. And we'll decide whether we do that, like put them out on the web, all the questions, or how we're going to do that yet. But, so we're going to open that up to questions now.
So is there plans to add any additional counties?
The original plan, once they did this project, right, with the selected counties, would be to do the project, work out all the kinks, figure out all the problems, get them all cleaned up, make it a quality program, and then CMS wanted to see how that would go. Like I said, Ohio, it's going great because it's mandatory. In Michigan, we're doing pretty good. I think we're second or third behind Ohio. And if they like what they see, and depending on the president and what he does, you know, the original plan was to try to make this regular thing, make it permanent. That was the original plan.
Yeah. So I have a couple questions. One is,
I need to restate it.
One of my questions is, when someone is 64 going to turn 65, and they have been receiving Medicaid, Medicare under the revised guidelines where they can have a few more assets, so that they were receiving full Medicaid, full Medicare up until the age of 65, and once they qualify for Medicare, that status with Medicaid changes. They are no longer able to necessarily get their Medicaid under a full Medicaid status. I run into a couple of these people, and it's very confusing how they transition and to what they transition to.
Right. Medicaid, if you're not on disability, is different before. Oh, so the question is, what do you do with a person that's 64, they're turning 65, and they had a Medicare, you said they had a Medicare and Medicaid. Now, are you saying then they were on disability?
Exactly.
Okay. And once they're 65, they are no longer looked at as on disability. That they actually have Medicare and Medicaid like everybody else does when they turn 65. So, and it's a difficult transition. I've had that personally when I've done some counseling, and sometimes it's really tough. You feel really bad for them because before they're 65, some of those plans they go into, by the way, cost them a lot more than when they turn 65, which is a good thing. When they turn 65, they can get the plan cheaper now because they get regular plans, so to speak, regular price like everybody else. What happens, though, is they're on the Medicaid Extended Program. What's that called? Shoot, trying to think. Blanking out on it. I'm just. Yeah, I'm trying. Yes, it is. It is. It was Extended Medicaid, and there's a name, and I'm just blanking totally on it right now. But anyway, that program covers everything. You know, it's really good and thorough. Well, they turn 65, and then they got to look at Quimby, Albee, Slimby, and depending on what they're bringing in, some of them don't end up full Medicaid.
Right.
So
they can have higher assets on the government program and get Medicaid and Medicare up until age 65.
Correct.
So my question is, for these individuals, who is notifying them that their status is going to change when they turn 65 and letting them know what they need to do because these individuals are believing that they are still qualified for that full benefit dual. And when I go into Medicare.gov, it actually says full benefit dual. And so I'm under the assumption, the client is under the assumption that that full benefit is going to continue on for them. When in fact it isn't. And they have a very short period of time in that 1 month period to sign up for their deeds and their other plans in order to not lose that guaranteed rate time.
I believe they do get a letter. I think the person I worked with got a letter, but I will double check that. Lily, if we can put that down as a question, I will double check that and get that back and get an answer for everybody on that, because that is a problem. I've had more than one with that problem. And when you go in after they're 65 and it says full, either the system hasn't changed it yet, or possibly they do still have full Medicaid under the federal poverty level for the 65 and older.
I believe when I spoke to Linda about that, she was saying to me that oftentimes what happens, at least this is how I understood, what I understood her to say, was that designation is going to stay on that person's record through the end of the calendar year, through the end of December. So as a counselor, you go in and you are under the assumption, because you're seeing a full benefit dual, and you're trying to sign them up or give them a choice when they turn 65 for a dual program, that they're not eligible.
So that's good to be aware of that. If you can't hear her, be aware that when somebody is on disability and they have that Medicaid extension plan, which I cannot recall it, I should know it, I'm just drawing a blank. They have that extended Medicaid, covers everything. When they turn 65, now all of a sudden we got to refigure for them. We got to look to get them on Medicaid savings plan, and because they turn 65. So it's always good to have that discussion with them, on find out what they had, and realize when they turn 65, you have to switch them over to a Medicaid savings plan if no one's done that. Help them already do that. See if they qualify for the OMB, Slim B, right?
But, well, what further complicated this particular situation was the husband also had Medicaid, but 73 years of age, and their assets and income were higher than what's listed for full Medicaid eligibility, and he was still receiving Medicaid, full Medicaid. Have no idea how or why that could have been, and so I don't even know.
That might have been a glitch in the system.
But when you're doing counseling with somebody, how do you know that? I mean, I ended up calling Linda on that particular situation because we don't, as MAP counselors, have access to understanding that. And because it's so critical when they first sign up for that program, that, with that guarantee issue, you don't want to screw it up, that, when they're turning 65, because they have that short window of opportunity to be able to get into, a Medigap plan. And a lot of these people are high-use, medical use folks who might need to be in a Medigap plan. That may be more costly for them, but would be more to their advantage because of their high utilization of health care. So am I to assume that those kind of cases, when we get them and they're very complex, we call Linda or you?
I would call Linda. So the question is, what do you do when you get those complex cases? They're coming off disability, they're high users of medical, they're turning 65, and after that, that changes their whole status. And it's pretty complex. The question would be what to do as a MAP counselor, and I would recommend to call Linda or myself on that so we can help you through that to make sure they get the right services. Actually, in fact, I probably had at least 3 people in that situation, and I don't see clients that often, but I was the lucky one to get 3 of them this past year. Yeah.
I have one more question.
Okay.
I always have one. So when you pull up a client's name at Medicare.gov and you're looking at what is their current coverage, if they have full subsidy, would it say full subsidy and full benefit dual ever? Or would it be one or the other? And if it says full benefit dual, can I assume that that's Medicaid, Medicare, and that is not LIS.
I think I've seen full subsidy, and I think I've seen dual, but I'm not sure I've seen full dual under that.
I've seen full subsidy dual.
Full subsidy dual.
And I'm like, what does that mean?
Okay, that's Lily will write that one down too, and we'll get that answer back to you. What does full subsidy dual mean? Good question. Really good question. Do you have any questions from those online today on the webinar?
I'm gonna unmute.
I believe Lily has unmuted those on the webinar today. Are there any questions from those?
I don't know why the bag didn't have tax. There's no tax on the bag.
Yeah. You want to see that?
Lily's having some difficulty with getting it so you can just ask questions. So if you wouldn't mind typing your question to her right now if you have questions, and we'll try to read those and answer those. You get anything, Lily?
Yes. I'm married. Hi.
I believe we have a question. The question is, what are the plans that are available for dual enrollees in Oakland County? Unfortunately, my health link does not cover Oakland County. It's only Wayne and Macomb. So it would be a matter of when you do plan comparisons, using your Medicare.gov plan finder and looking that way to see what is available. I'm not aware, there are some special needs plans. They're in your Medicare book. I'm not aware of any other special plans for duals at this time.
PACE,
Well, you could do some of that, the waiver stuff.
and PACE, is that for Oakland County? They PACE in Oakland?
You know, I'm not sure. I thought everybody had PACE, but I could be wrong on that. You know that, Beth? I will follow up on that and make sure I'm not missing anything on that for Oakland, but I'll see what I can find out for that. Good question. Thank you. Any other questions today? If you have questions after this webinar, feel free to email them to me and I will get an answer for you. My email is judy@mmapinc.org. judy@mmapinc.org. We want to thank you for joining us today. Again, this webinar, this PowerPoint will be shared with Macomb and can certainly share it with Wayne, and it'll also be on ShipTool.